My name is Dr. Shahid. I'm a general pediatrician and medical educator. And in this video series, we've been talking about preventing burnout and how to develop resilience for doctors and medical students. Today's topic is going to be self-compassion as a strategy for developing resilience. So let's go ahead and get started. So just as a reminder, the definition of burnout is a syndrome characterized by exhaustion, cynicism, and reduced effectiveness. So basically with burnout, there's a loss of enthusiasm for work, there are feelings of depersonalization and detachment, and there's a low sense of personal accomplishment. So when you have resilience, that helps you and protects you from burning out. And when you have resilience, you have energy. But when you develop burnout, you start to lose that energy and you get exhausted. When you have resilience, you have compassion. But once again, once you start to burn out, that compassion turns into kind of a cynicism and depersonalization and detachment. And when you have resilience, you have efficacy. And when you start to burn out, you start to become ineffective. So really, burnout makes us not care about our patients, not care about ourselves, not care about our work and our productivity. So we have to be very careful about developing the burnout and using resilience strategies to prevent that from happening. And again, this is my diagram of how I view wellness and burnout on opposite ends of the spectrum. Wellness and things that promote wellness can help prevent burnout. The blue arrows going back and forth indicate that there's overlap. So developing resilience can help prevent burnout, and anything that prevents burnout can help develop resilience. And we've been talking about different wellness strategies and resilience strategies and self-care strategies. And in various videos, a lot of these topics have already been covered. But today we're going to talk about, under resilience strategies, the topic of self-compassion and empathy, and really focus on self-compassion. And again, these type of resilience strategies can help develop resilience, but they can also prevent burnout. And self-care initiatives can prevent burnout, but also develop resilience. So there's overlap with all of these, so you can check out other videos on these topics. But today we're going to focus on self-compassion. So before we talk about self-compassion, let's talk about compassion itself. And what does compassion mean? So this is one of the definitions of compassion. It is being touched by the suffering of others, opening one's awareness to others' pain, and not avoiding or disconnecting from it, so that feelings of kindness toward others and the desire to alleviate their suffering emerge. So basically, compassion is about having this feeling of kindness toward others, where you want to help others as they're going through some sort of suffering or difficulty, and you want to help them get through that difficult time. So that is what compassion is. So unfortunately, we suffer compassion fatigue, and that's where a caregiver has reduced capacity or interest in being empathetic and compassionate. And compassionate fatigue is really a form of burnout. So we have to recognize, if we are suffering from compassion fatigue, that we might be on the verge of starting to burn out. So what is compassion fatigue? Basically, is being overwhelmed by all the dreadful events and conditions in the world that make us feel powerless to make a difference. So this could be true for patients, where as students and residents and practicing physicians, we may feel powerless in making a difference in the care of our patients. And that can lead to compassion fatigue, and we're overwhelmed by that. And right now, as I'm making this video, we're in the middle of the COVID pandemic. So a lot of the healthcare providers are feeling compassion fatigue because they're overwhelmed by the volume of patients that are needing to be cared for, and the feeling that sometimes it doesn't make a difference, and the outcome can still be not what you were hoping for. And this compassion fatigue, it might not only be just for patients, it could be for anyone who's also not in healthcare, where you just kind of feel overwhelmed by the situation of the world. Again, with the COVID pandemic, a lot of people who are not in healthcare are feeling compassion fatigue, because you feel powerless in being able to do something for your loved one or your family, as they might be suffering from the COVID during this pandemic. So compassion fatigue is having that type of feeling. Okay, so getting back to compassion, it's very important for healthcare providers to have compassion, because patients who perceive a lack of empathy and compassion in their care tend to sue for malpractice at a higher rate. And those patients are less likely to return for care and have poor clinical outcomes. So providing compassionate care as a healthcare provider is very important in developing a strong relationship with your patient. So we must maintain compassion for our patients and maintain compassion for others, but we have to realize that we have to maintain compassion for ourselves as well. So while compassion for others is celebrated as a virtue, self-compassion is often incorrectly equated with self-esteem and viewed as a selfish or overly self-centered type of feeling. So it's interesting, we are so compassionate for others, we want to be compassionate for others, but somehow having self-compassion is looked down upon. Sometimes somehow it's viewed as being selfish. So we have to change this perspective, because self-compassion is such an important aspect that we have to take care of ourselves to help us prevent burning out. So self-compassion, it is a very, very important component of resilience, and we must develop self-compassion as a resilience strategy. And we know from the literature that there's a positive correlation between self-compassion and well-being. And we also know that self-compassion can be a means of resiliency against stress, against burnout, and against emotional exhaustion. So again, self-compassion is a very important resilience strategy that we must develop to help protect ourselves from burning out. So this quote helps summarize what is self-compassion. Self-compassion is simply giving the same kindness to ourselves that we would give to others, right? What does that mean? The compassion we give to others, those feelings of kindness and wanting to help them in their time of difficulty and suffering, we need to direct that toward ourselves. So when we're going through a hard time, when we're going through some difficulty, we're going through some stress, we have to be kind to ourselves. We have to learn to be not so hard on ourselves and not so negative and critical on ourselves. So that is self-compassion. Self-compassion is actively encouraging the expression of warmth, concern, and caring toward yourself. Self-compassion is a positive and caring attitude toward yourself in the face of failures and individual shortcomings. This is, I think, very, very important, because this is so hard for medical students and for residents and for practicing physicians, right? Because we're all such high achievers and perfectionists that when we fail or we make a mistake or we don't live up to our own expectations, we are so hard on ourselves. We are so critical of ourselves. So we have to learn to do this. And we're not very good at exhibiting self-compassion, but we have to learn this skill. We have to practice this skill. And it's a very important resilience strategy that we really have to understand and try to implement that. So there's three facets of self-compassion. Those include self-kindness, common humanity, and mindfulness. So self-kindness is having an understanding behavior toward oneself in the face of suffering. So basically it's really reducing that self-criticism and that blame that sometimes we put on ourselves when things don't go well. So we need to learn to be kind to ourselves and not so hard on ourselves and be forgiving of ourselves. And that is part of self-compassion. Common humanity, the second facet of self-compassion, that is the perception and classification of one's experiences as part of mankind rather than an interpretation that is separate from others. So what does that mean? It means that everyone makes mistakes, right? And that the way that you feel after making a mistake, many people feel the same way. So we have to realize that the feelings that we have, any feeling that we have of guilt or blame or just anxiety or stress or being overwhelmed, those are feelings that everyone is also having in that same situation. So we should not feel isolated. Part of self-compassion, common humanity, is making sure that you don't feel like you're the only one going through this difficulty, right? You're the only one this is happening to, right? That's not true. It's all about common humanity, meaning that others are going through similar feelings, similar type of processes, and we have to recognize that, and that is part of self-compassion. The third facet of self-compassion is mindfulness, and this is the balanced awareness of negative thoughts and feelings rather than their over identification. So we have to be mindful when we have these negative thoughts in ourselves and about ourselves, right? When we feel blame and guilt and shame when we make a mistake or things don't go well, right? We have to be mindful of the fact that we're having these negative thoughts, and we have to reframe those thoughts into something positive and not over identify with them, meaning like not overreact to those negative thoughts, right? Try to learn from what might have happened, but to change those negative thoughts into something positive, and not overreact to those negative thoughts then. In another video, I talk a lot more about mindfulness, so you can check that video out. I'm not going to go into a lot of details about it, but it is a form, or it is a facet of self-compassion, and mindfulness can help develop self-compassion as well then. So to summarize these three facets of self-compassion, we talk about mindfulness. So that's self-compassion involving and recognizing that you are stressed and that you're struggling, and not being judgmental about it and not overreacting to it. The self-kindness, so being supportive and understanding towards yourself, well, when you're having a hard time, rather than being harshly self-critical. And that connectedness, or that common humanity that we talked about. So remembering that everyone makes mistakes and experiences difficulties, and that you're not alone in this. Self-compassion is about acknowledging your feelings and recognizing that others likely feel the same in a similar situation, right? So what does that mean? So when you feel like you need to hug someone because of their difficulty, self-compassion is that hug, right? We all need a hug sometimes, right? So self-compassion is in any given moment when you're struggling or you're going through difficulty and you wish there was someone around to hug you, self-compassion is giving yourself a hug, right? Helping you feel that warmth, and that kindness and that forgiveness, by doing that. So I think that's a very important aspect that we all need to recognize, and that's what self-compassion is all about then. So again, when you have self-compassion, you don't consider your own mistakes with a harsh and negative emotional feelings, right? You frame them into something more positive, and that can help develop your well-being. So you're nicer to yourself, you're more kind to yourself, right? So when you make a mistake, you learn from it, you grow from it, you develop from it, right? And that's a positive. So you try to take the negative and you turn into a positive by being, again, less harsh on yourself and less negative and less critical, and less, blaming yourself, but learn to be nicer to yourself, more kind to yourself, more forgiving of yourself. And that's a part of the positive thoughts that you can then reframe something, mistake that you might have made, to learn from it and grow from it. Part of self-compassion is reflection, and that can really help increase your self-compassion. So kind of reflecting on the situation and what happened, and what you can learn from and how you can grow from it. So that's part of that reflection. Also, self-compassion is working towards being better and not perfect. I think this is so important, right? Because again, we're perfectionists in the healthcare field, as a medical student, as a resident, as a practicing physician, right? We're high achievers. We want to be perfect, right? We set our goals and want to achieve them perfectly, right? But we have to recognize that no one is perfect, right? And our goal is not to become perfect. Our goal is just to become better and just to be able to improve ourselves. And that's what self-compassion is all about, is recognizing that and reflecting on where you can improve yourself, but not thinking that you have to be absolutely perfect. So I think that's a very important part of self-compassion that we as healthcare providers and students and residents and practicing physicians, sometimes we don't recognize that and realize that about ourselves, that we just want to improve and get better and not necessarily shoot for perfectionism, because no one is perfect. So developing self-compassion may be vital for prevention of compassion fatigue and promotion of compassionate care. So it's so important for the care of our patients that we are compassionate, right? But it's so important for our self-care that we exhibit self-compassion as well, right? So we have to keep that in mind. So how do we develop self-compassion? Let's talk about some strategies that can help develop self-compassion. The first strategy I want to talk about is emotional intelligence, because emotional intelligence can be one of the ways to develop self-compassion. I've talked about in another video some details about how emotional intelligence skills can help develop resilience. So we know that emotional intelligence skills can really help you build a loving relationship with yourself. Emotional intelligence skills allow you to learn how to respect yourself, how to be kind to yourself, how to be generous to yourself, and how to be forgiving of yourself. And again, these are all aspects of self-compassion. These are all aspects of emotional intelligence that help you develop self-compassion. So again, in another video, I've talked in detail about this, so you can check out that video about emotional intelligence and resilience, but it's definitely related to developing self-compassion. It's very much related to this topic that we're talking about right now. And again, using these EI skills, right? You must learn to have respect for yourself and value your contributions to the team, right? We are not very good at this, right? Because we're very humble, right? And we don't do this very well. We don't respect ourselves and the value that we bring to our team and the contribution that we are making to our team, right? So we have to step back and appreciate that and recognize that and have that self-compassion and that self-respect of the value that we bring to our team and the contribution we make to our team. So we need to learn to do that. The second point here, you must be kind towards yourself and not overly critical of your own actions. And again, we've been talking about this, about self-kindness as a part of self-compassion. So again, we are our worst critics, right? We are always so critical of ourselves. We need to learn to be kind to ourselves. When something doesn't go well or there's a mistake that's made, again, we need to be kind to ourselves and not overly critical, just learn from it and grow from it and kind of move on from it. The third point, you must be generous towards yourself and give yourself a special treat to celebrate your successes, right? That's part of self-compassion. When you went through a difficulty, you went through a stressful time, right? You went through some sort of suffering or something, right? When you got through it, when you worked through it, right? Celebrate that success, right? Be generous to yourself, right? So you had an exam, you took a shelf exam or a board exam or some sort of tough exam, right? You got through it, you worked hard, it was difficult, it was stressful. After you got through it, celebrate in some way, right? Do something kind to yourself, something generous for yourself to celebrate that whenever you achieve a goal. That's important EI skill, but it's also important to develop self-compassion. The last point here is, again, you must be forgiving of yourself when you make a mistake and learn to forgive yourself so you can move forward and not dwell in the past. Again, forgiving yourself is part of self-compassion. It's an emotional intelligence skill, but it's a part of self-compassion as well. So not to feel guilt and shame, but again, just to learn from it, reflect on it, and then forgive yourself and then move on from it and don't dwell in the past. So again, these are very important emotional intelligence skills related to self-compassion that we must learn to practice on a regular basis to help develop resilience and to help us to prevent us from burning out. So meditation is another type of skill and strategy that can help develop self-compassion. In another video, I talk in some detail about meditation, so you can check that out. But one type of meditation called loving kindness meditation can help develop self-compassion because it's an exercise where you direct compassionate images and thoughts toward yourself and towards others. So it develops compassion and self-compassion. So again, different types of mindfulness and meditation, as in this example, can help you develop self-compassion. And we talked about mindfulness before as a facet of self-compassion, but also it definitely can help develop self-compassion. So there's different type of programs. The specific program called mindfulness-based stress reduction can be very helpful in developing self-compassion. It's where you take a non-judgmental approach and you are kind of present in the moment, and this can really help practitioners become less vulnerable to stress and to help to develop self-compassion. And again, this has been studied and it's been shown that this type of mindfulness type of program can significantly increase self-compassion and can increase increased compassion, can help decrease stress and can help therefore decrease burnout. So I think this is a very, again, a very important aspect of self-compassion and strategy. So again, this mindfulness type of activities, meditation, emotional intelligence, these are all strategies that can help you develop self-compassion as you develop your own resilience and prevent burnout then. So to kind of summarize, again, we know that self-compassion builds resiliency, which can then protect against depression and anxiety, and it can help increase life satisfaction and optimism and social connectedness and happiness. So again, self-compassion is a very important resilience skill that we must learn and practice. And again, unfortunately, medical students, residents, practicing physicians, we're not really good at this, right? We're not good at practicing self-compassion. So we need to learn to be better at this. We're more kind to ourselves. We are more forgiving of ourselves. We're more gentle to ourselves. That's a very important that we need to learn to do this. So again, in healthcare, we're so focused on being compassionate to others and being compassionate to our patients. But again, we have to be compassionate to ourselves as well. And this self-compassion helps us develop that and helps develop resilience, and that can help reduce the risk of burning out. So it's a very important aspect that we have to keep in mind then. Again, so this is the overview of wellness and resilience that we talked about, and today we've been focusing on self-compassion as a resilience strategy. And again, in other videos, I've talked about a lot of these other resilience strategies and self-care strategies. So you can check out those videos on a lot of these different topics. And hopefully this one on self-compassion today was helpful and beneficial. And I want to thank you for watching this video and look forward to viewing the other videos that I put up about resilience and prevention of burnouts.